IVM.
Welcome to a bonus episode of This Round is on Me. We all find ourselves flooded with information about COVID, and it's hard to sift through it to determine the truth from the fake forwards. Today, we're going to get the hard facts from a doctor on the ground, Dr. Pankaj Narvekar, who spent most of last year in charge of the NSCI Dome facility, which is Maharashtra state's first COVID center in Mumbai, with the capacity to treat over 500 COVID patients. Since then, Dr. Narvekar has moved to the Podar Hospital in Worli. Dr. Narvekar, thank you for taking the time to join us today. Before we get into the questions, Doctor, can you take us through how you got involved with NSCI and what the last 1 year has been like for you?
Sure. So basically, my qualification is in sports medicine. So while I was working with the weightlifters and the pandemic hit the country and the entire world, there was a lot of appeal for doctors to step in and work for people. So I saw a lot of Instagram posts, and that's how I came to know that, I can work for people of my city and my country. So through that post, I joined Dr. Mufazzal Lakdawala and his team in the beginning of pandemic in NSCI.
Okay, and what has this last 1 year been like for you?
It's been absolutely a roller coaster. So since the pandemic is completely new, COVID was completely new for everyone. We used to learn new things every day, like from wearing a PPE to removing a PPE and then managing patients, looking at the patients suddenly collapse and, them getting better and leaving the facility, their tears and joy when they leave the facility.
Right.
It was all amazing.
So the idea of having you join us today is that, is so that you can answer first hand some of the basic questions that people have on the subject, because of course there's a lot of information going around. So let's begin with testing. Can you please take us through the different types of tests and their efficacies?
Sure. So currently we have 3 types of testing. One is RT-PCR, which is also called as molecular test, which has the highest reliability in terms of diagnosing COVID, and which is widely used in our country as well as the world. The second is rapid antigen, which is a very quick test in diagnosing COVID, where you get the results in like 15 to 20 minutes. But it is not really reliable, where, we have seen a lot of cases where they were not seen positive on rapid antigen, but positive on RT-PCR. So RT-PCR is more reliable. And there's this third one, which is antibody test, which is usually seen significant after the COVID infection.
Okay, so that is taken after the infection, you're saying?
Correct.
Okay, and then there's of course the antibody test, which is just again taken presumably, it can be taken anytime, but then it shows whether you've likely had it or not.
Correct, absolutely.
Okay, so between taking sort of the 3 tests, the antigen test as well, what is it that people should be taking if they find themselves having symptoms, or is it necessary to get tested if you find yourself having symptoms, or is it safe to assume you have it and take the necessary precautions? So when do you need to get yourself tested, and which test should you be taking?
Correct. So it all depends on a lot of criteria. If someone has comorbidities, if the age is towards larger side. So if someone has basic symptoms like loss of taste and loss of smell, and there's no breathing difficulty, no fever for longer duration, one must think about getting isolated, because there is a huge load currently in the labs for the tests. So the reports usually take more than 24 hours these days, whereas the reports used to come within 8 hours.
Right.
So yeah, if there are, literally the mild symptoms, one must go for isolation, home
Oh,
isolation preferably.
okay. And so what you're saying is that if you, I mean, everyone knows what broadly now what the symptoms are. So if you find yourself
Correct.
having some of these symptoms, just quarantine and ride it out for
Yes.
that 14-day period, and
Correct.
don't rush to get a test if you have
Correct.
the capacity to be isolated. And then
Right.
should you be, and presumably if you have taken that 14-day quarantine period, then and you feel fine, and you can see that
Mhm.
those symptoms are potentially going away, then again you may not need to test at the end of that period. Is that correct?
Correct. Correct. Absolutely.
Okay. And so at what point should you consider hospitalization? Is it necessary to consult a GP, or is calling the BMC helpline good enough? How do you kind of go about this if you do start seeing slightly more severe symptoms? And also, what are those severe symptoms?
Right. So severe symptoms include, first of all, reduced oxygen saturation, which is also called as SpO2, which is which you can simply see on a pulse oximeter device, which can be put on your finger. Anything below 94% of saturation of oxygen needs hospitalization. That means the saturation of oxygen in the blood is going down, where the person will need oxygenation. So anything below 94, you should visit a nearest COVID center, or you can call the BMC helpline, or you can visit your GP as well.
Okay. So I think right now what the BMC is advising is to call the helpline to know where you can visit, which is the nearest center, and where there are
Correct.
so does that mean that it's more about going to the center before necessarily admitting yourself into a hospital?
Correct. So they will guide you with the symptoms and the severe. They will, assess you and look at the symptoms and severity of it. And then, depending on that, they will let you know if you need to get hospitalized, or you can go for home quarantine and home isolation and continue the treatment.
Okay. So when you call the BMC helpline, the main information to have, of course, is what symptoms you're seeing, as well as your
Correct.
SpO2 count, taken through a pulse
Correct.
oximeter, and your temperature, etc.
Right.
Okay. And
Right.
we've obviously been seeing a lot of messages of people asking for hospital beds. So what should someone do if the helpline is unable to help with finding a hospital bed at that time?
So first of all, if a person has reduced oxygen saturation, and if the bed is not available, or the BMC helpline is not able to help you, first of all, till you get any help, proning should be done. So proning is basically lying on your abdomen, which helps you in improving the saturation.
Okay. This is basically lying on your stomach,
Correct.
and for a certain amount of time, or
Correct.
how long
At
should?
least 30 to 120 minutes. So
Okay.
basically, we have a larger number of lung tissues at the backside of the lungs.
Right.
So when you go into proning, the pressure on the lungs, pressure at the back of the lungs is reduced, and the tissues get more oxygenation by that.
Okay. And
Yeah.
so at what point, so should someone be concerned about getting an oxygen cylinder? So I've been seeing messages, on social media about people somehow managing to get a cylinder at home if they're unable to find a bed. And then comes the next step of knowing how to use it. So is this something that, is a viable option?
It is definitely a viable option. Oxygen cylinders, or you get oxygen concentrators as well, which runs on electricity. Oxygen cylinders have certain amount of liquid oxygen in it, and once it is completely consumed, it gets over. And whereas oxygen concentrator will keep running till the time you have electricity.
Okay.
And it's a basic instrument which everyone can keep it at home. So the basic things, there are 2-3 types of mask, and The basic one is nasal cannula, which you might have seen, a basic tube which can be put in your nose. It helps you deliver 2 to 5 liters of oxygen effectively, and it can be used at home. The safer oxygen delivery at home is one when someone needs the flow of 2 to 5 liters per minute. If
Okay.
anything goes beyond that, and if someone is not able to maintain the saturation of 95 and beyond, even on oxygen, then they should consider hospitalization.
Okay. And what you mentioned earlier is that if you're unable to get access to a cylinder till the time you reach the hospital, proning is the best alternative.
Yes, it's the best alternative.
Okay. Let's talk a little bit about the medication. We've been seeing messages about people looking for remdesivir and various other medicines.
Right.
What actually are the different types of medicines being used, and at what point does someone need to be actively obtaining these?
Right. So basically, remdesivir is an antiviral medication, which is actually not approved by WHO since the efficacy is not really observed in the clinical trials. But in India, it is approved by the state government as well, the state task force and the national task force as well for emergency users. It is an antiviral which helps you get the viral load down in your body. It helps in relieving the temperature, like getting the temperature down and improving the oxygen levels. Remdesivir is an antiviral medication, whereas vaccine, it will help you prevent the complications of COVID. So even when someone is hospitalized, these medicines are used. Even dolo is used if in case there's a fever. So paracetamol helps you get down the fever, but antiviral is something which works on the virus inside the body. So it helps you relieve the infection inside the body.
And are there various antivirals other than remdesivir? Because we've been seeing sort of requests for these, other medications as well on social media.
So there's one alternative which is favipiravir, which is a which comes in a tablet form. The only drawback with that is someone needs to take a lot of tablets because the loading dose of that medication is 1800 mg and then 900 mg for next 4 days. So someone who is advised with favipiravir has to take 9 tablets of 200 mg in the morning and 9 tablets of 200 mg in the evening. So it comes with a lot of cons that someone may feel nauseatic and dizzy after these medications.
Right. So,
Yeah.
at what point does someone need these? Because, like you mentioned earlier, if you have milder symptoms, then you can self isolate and, hopefully let the virus pass naturally.
Right.
So, what medication should you be taking if you are self isolating? Should you not be taking anything or only taking something if you have a fever? And at what point do you need to be starting to sort of consider taking something antiviral?
Right.
And is this only after consultation with the GP or hospital that you should be looking to take this?
Right. Ideally, these medications like remdesivir and favipiravir and certain steroids, when these drugs are administered, we have to monitor the blood sugar level and temperature, etc. So ideally, these should not be taken at home. When someone is asymptomatic or mild symptomatic, they can use the multivitamin protocol, which consists vitamin C, vitamin D, a multivitamin B complex, and zinc tablets. So these can be used as it has no side effects until unless someone is allergic to certain medication. And if there's fever, then paracetamol 650 mg or 500 mg will help. But again, if the fever is not subsiding for longer duration, like 3 to 4 days, then one must take consultation from the GP or they must visit the COVID center.
Okay. And you've talked about using blood thinners. Is that, can you explain that a little more?
Correct. Yeah, blood thinners are very essential. As you know, in COVID, it is seen that people have excessive blood clotting, which can be lethal in terms of if they reach your lung tissues, breathing can be affected. If they reach your heart tissues, the heart function can affect. And if they reach your brain, then it can cause a permanent damage in your brain. So blood thinners help us in, avoid these blood clots, which is commonly seen in COVID. So there is enoxaparin, which is an injectable blood thinner, which is used. And if someone is like really young, we can use aspirin, which is the
But again,
alternative for enoxaparin.
right. But again, these should only be taken under the administration or the
Correct.
guidance of a doctor.
Correct. Supervision of the doctor.
Right.
Absolutely.
And just one last question on the medication part of it. You mentioned multivitamins, etc., being taken when you have mild symptoms and you can self-isolate. Are these something that people should be taking just on a daily basis anyway, just to boost immunity?
It'll be absolutely fine if they take it, because if you look at our diets, we usually prefer eating outside a lot of times or ordering food from outside. We don't really get a lot of nutritions, vitamins, as per the requirement of the body to fight any disease, or when you need improvement in your immunity. So definitely, according to the required daily advices, we can take these medicines. Like if you're talking about vitamin C, then 1,500 mg a day is absolutely fine.
Okay.
Yeah.
So for those who have had COVID now and want to, there's sort of a lot of requirement for plasma.
Right.
So for those who want to donate it, can you please take us through the do's and don'ts of that?
Yeah, absolutely. So plasma is something which is recently tried a lot usually in severe cases when a person is on ventilator or in ICU. The plasma really helps a lot of times, but it is not really seen to be, really very helpful. It has a lot of side effects as well, because definitely the plasma which is administered in someone's body is not part of that person's system. It is taken from someone else's. So there's a theory called as foreign body theory, which damages more. So it should be done with caution. So plasma is usually taken after 28 days of the infection. If someone has got COVID, say on 1st of April, the person can donate the plasma after 28 days. That is after 28. It also comes with, precautions that they need to check for the antibodies in the blood. Then only they can donate the plasma. Yeah.
There are a few organizations that have been set up to receive plasma donations. So presumably that's just where people should be reaching out if they've had
Absolutely.
COVID and they feel that they can that they want to donate.
Absolutely. There are a lot of organizations like NGOs who are appealing people who were COVID positive previously for the donation of plasma. And it's absolutely, fine if we can try and help in any way possible to a person who might lose his or her life.
Right. Let's talk a little bit more about the vaccine. Of course, we want to encourage everyone to take the vaccine. There are a lot of skeptics who have their reasons.
Right.
One concern that I've heard is that the vaccine requires a specific type of cold storage facility, which many vaccine centers are unlikely to be equipped with. And so there's some doubts and concerns about the effectiveness or quality of the vaccine. Can you shed any light on this?
Yes, definitely. It needs a proper cold storage. It needs a certain temperature where the vaccine is supposed to be stored. So Ideally, I would say it's my personal opinion. I won't say everyone should follow it, but one should visit the government hospital since the supply is large and the vaccines are used frequently since a lot of people go for the government hospitals. So there are less chances that the vaccine which you receive is not potent, is not stored properly or not used properly, since the vaccine keep on getting replenished once it gets over.
Okay. So there's no
Yeah,
concern about, regardless of where you are, whether it's in a big city or a small town, people shouldn't
absolutely.
be concerned about the storage facilities that are being, are being made available for the vaccine.
Absolutely no, because these people are trained how to maintain the optimum temperature of that, and government facilities are absolutely taking care that the vaccine is properly maintained and delivered to each and every citizen of this country.
Right. So, just to clarify about getting COVID once you've had the vaccine, can you still be a carrier of the virus even after you've taken it?
So I would explain you in a different way. See, if someone has taken first shot of the vaccine and then the person turns positive, it's absolutely fine. So what vaccine does is it avoids the complications which one might experience, during the infection. Like for
It
example,
minimizes the effect of those.
yes, absolutely,
Yeah,
absolutely. So if someone who might, land up in ICU, if you have vaccines, definitely the complications will be less. You might need oxygen, but you will recover quickly and go back home.
okay,
There's one more point which I would like to explain is, once the vaccine is taken, the first shot is taken. If you want to take the second shot, what you have to do is once your isolation is complete, you have to follow 7 days home quarantine period. And once you're absolutely fine and asymptomatic, you can go and take your second shot as per the regular schedule.
so what happens if you take
Second
it?
thing,
Sorry, I mean, what happens if you take it earlier? Say you're
um,
asymptomatic and you take it earlier. Is there any harm?
no, the the major concern behind that is, you cannot go there, and if possibly you are still in infectious period, you might go there and infect others who are there for vaccination.
Got it.
Yeah, and there are a lot of concerns about, if a person was never positive, and I mean, if person was never vaccinated, if a person is positive, when to take the vaccine. So ideally, once a person is positive, he or she can take the vaccine after 6 to 8 weeks from the date of first positive test.
Right. And presumably you
Yeah,
also hopefully have antibodies, which mean that you
correct,
be protected for a little bit longer.
correct. Makes sense.
Um, so I still have a question about the fact that a lot of people feel that after taking the vaccine, they won't get COVID, but that's a misconception. The point is that you could still get it, but your symptoms will be a lot milder. And the reason I ask this is
Right,
that you could still be a carrier and therefore infect those around you even after you've taken the vaccine. So while it might protect you better,
correct.
it could still affect those around you who may not have been vaccinated yet. Is that correct?
Absolutely right. Because what happens is, if you're vaccinated, it'll protect your body. But if you're positive, if you're COVID infected during that period, you can definitely spread it to others who are not vaccinated. And there are high chances that they might land up in complications. So still, what we advise is, even after vaccination, you are supposed to use the masks.
Right. Absolutely. Okay.
Yeah.
And you were saying something earlier, sorry, when I asked you the clarification question about the vaccine. So is there something else that you wanted to add on this?
Yeah, I just wanted to add, there was a lot of skepticism that, people were like, that you get COVID positive when even if you're vaccinated. So you should not take the vaccine, or there are chances that you might die after the vaccination, because there were few cases. So when you go for vaccination, the person who provides you with the vaccine explains you all the aspects of vaccine and what to do and what not to do. So basically, there are certain medications which are supposed to be avoided when you're vaccinated, like diclofenac, which is commonly taken for pain. Instead of that, you can take paracetamol, which is a painkiller. So it will avoid the complications after the vaccination. And definitely, I would advise everyone to get vaccinated, because it is really essential to protect yourself and others, from the COVID complications.
So that's the thing. It's just, I mean, go back to that point. I think what I'm understanding is that taking the vaccination protects you more than it protects others.
Right. Makes sense.
Okay. And also, there's also a lot of questions out there about which vaccine to take. While I don't want to sort of necessarily, ask you to get into comparing them, but
Right.
is there anything that people should be considering? Because of course now there's talk about introducing some of the international vaccines as well,
Correct.
making those available locally. So are they, for all intents and purposes, people can take whichever one they can get
Mhm.
for the first dose?
So both the vaccines which are currently available in India, Covishield and Covaxin, both are really effective, and they have really good efficacy. Um, the number of people who have received Covaxin is less as compared to the Covishield, because of availability. There's
Sure.
nothing like, one vaccine is much better as compared to the other vaccine. We need to get more people vaccinated to get a better statistical data. So both the vaccines are really effective, and one should go and get vaccinated, whichever vaccine you get. Just follow the duration between two vaccines, and that should be it.
Right. Um, Doctor, we're hearing sort of news about a third wave, or the fact that we've not yet seen the peak of the second wave, which could hit 5 lakh cases a day, and that, the current number of ICU beds and medical staffing is inadequate for this.
Right.
Is this true, or and what, more importantly, can we do now so that we're better prepared to tackle what's coming?
Right. So basically, yes, it is absolutely true that we might get third wave, and we are still into the second wave. Recently, we were experiencing really bad issues. I mean, in terms of shortage of oxygen, a shortage of ICU beds, because of which people have lost their lives. So the best advice which I can give to everyone is just follow the basic protocols, the basic safety protocols, that is maintaining social distancing, using masks, and maintaining basic hand hygiene. So that would certainly prevent spreading the infections. If it is not really required, do not step out of the houses. Because whenever I step out of my accommodation, go for work, I see a lot of youngsters roaming around without the masks and unnecessarily crowding at some places, which is really horrible, and which in turn loads the healthcare system a lot.
Okay. I mean, I completely sort of understand. Is there anything else, any last words for our listeners, Doctor? Anything else that we've not covered that you'd like to share?
Yeah, I would advise everyone to get vaccinated, follow the basic safety protocols, and that will help everyone, and especially the healthcare workers, to help the people who really need hospitalization, and who really need the care and medication and everything. If you unnecessarily go out and crowd and spread the virus, it will be very difficult for us, and it will be very difficult for our country to manage the situation. So these are the bestest things one can follow. Yeah, that is the gist I want to explain you.
Thank you.
Yeah.
Doctor, on behalf of everyone tuning in, I just want to say a big, big thank you from the bottom of my heart for all the dedication and hard work in helping to fight this pandemic. And, you're a true hero. And I'm
Thank you
eternally
so much.
grateful to you for everything you're doing. And once again, thank you for taking the time today to speak to me and clarify all these points.
Thank you. Thank you so much for the opportunity as well. Thank you.
I hope you found this episode helpful in clarifying any doubts you may have had. Just as a reminder, the COVID helpline number is 1916, and you can find your local war room number on Instagram at my_BMC. Thank you for tuning in. Stay safe and please get vaccinated if you're eligible.
I hope you enjoyed that show. If you aren't following us on social media, please do. We're IVM Podcast on Twitter, Facebook, and Instagram. We'd like to thank the sponsors on the network this week, Cred, Ciet, TheWholeTruthFoods.com, and PayPal. We really appreciate your support. So this week on Cyrus Says, Cyrus had some interesting guests. Kayaz Irani was on to talk about his new Netflix film, and Mayur Tekchandani has made a new coffee table book about the city of Mumbai, which he came to discuss on the show. On the Wire Talk, Siddharth Bhatia was joined by Dr. Ali Khan Mahmoodabad to talk about the Muslim community's issues during these thorny times. On The Habit Coach, Ashton Doctor is joined by Sonia Jas to talk about the importance of fitness and why this is a great time to begin a journey to good health. The Simplified Gang has reunited and they discuss the hue and cry around the European Super League that was eventually just dropped after 2 days. On Shunya One, Shilith and I are talking to Gurubat from PayPal India. We talk about fintech, the future of digital payments, and a whole lot more. Really, really deep and interesting conversation about PayPal, its plans in India, and what kind of hiring they're looking to do. On The Millennial Athlete, Tanvi and Shlok were joined by sport and performance psychologist Dr. Shri Advani to talk about mental health for young sports stars. And I just want to again mention some of our cricket shows. The IPL season is on and you should definitely check out Edges and Sledges. And we also have a Hindi show called Khel Neeti. Do check that out as well. And with that, we hope to see you again next week.
पेश खिदमत है आपकी शान में हमारे अंजुमन से. Hi, I am Sadaf.
And I'm Arshit. खाने का इतिहास, economics, policy, psychology, सब है मेन्यू पे.
Only on the Nankali podcast every Wednesday, सिर्फ IVM podcast app या वेबसाइट पर या फिर जहां से भी आप अपने podcast सुनते हो.
Whether you're an established sports person or a budding one or simply a sports enthusiast, join us, Tanvi and Shlok.
We are two passionate pro badminton players talking policy, mindset and everything sport.
So tune in to The Millennial Athlete every Monday.
Only on the IVM Podcast Network.
Trust us, it's gonna be lit.